Hi everyone, I'm Haley Blackburn, and as previously promised, we're now to the section where I get to talk about some of our solutions and adaptation strategies that we can take to address our anticipated impacts on the health of the people that we serve and on the systems themselves. So in this section, we're going to go through and describe some of the frameworks used in climate adaptation planning, including the CDC BRACE framework and others, and look at these as a process for developing climate adaptation strategies. And this will include identifying resources for healthcare systems and providers to use to assess climate readiness and develop adaptation strategies. So when we talk about adaptation and mitigation and reducing our risks, mitigation is going to be essential to avoid the worst effects of climate change, but adaptation is going to be essential to minimize the impacts of climate change that are already baked in due to previously emitted greenhouse gases. And so we need to think about both of these simultaneously. And so when we're thinking about adaptation and mitigation together, this is something that we can kind of coin the term climate smart. So we want sustainability and resilience in our systems. Adaptation efforts can reduce the harms associated with current and unavoidable changes like food security, heat, vector-borne disease, and extreme weather. And this is how we're going to achieve the best outcomes. If we only focus on one or the other, mitigation or adaptation, we'll have better outcomes, but this isn't going to be the optimal scenario. So in general, when we think about resilient systems, there are resilient design principles. And the ideal characteristics of resilient systems are that they're large scale, they transcend scales, they work on multiple levels across regions and across time frames. So they're not just going to work right now, they're going to look into the future and into projections. They also should be adaptive and kind of embrace the risk and uncertainty to increase our learning and our ability to improve. They're diverse and redundant, so there's not just one pathway, one barrier. It's going to be something that there are multiple options. They're simple, passive, flexible. They're not something that's overly complex, and if one piece breaks, that's going to cause the whole system to go down. They're durable or even anti-fragile, which means that in the case of a stressor on the system, it not only recovers to pre-event levels, but it actually gets better. Ideally, we're going to want these resilient systems to also be sustainable. We want them to use locally available, renewable or reclaimed resources that are easy to procure. These systems are going to anticipate interruptions and changing conditions, recognizing that this is a dynamic thing, and this kind of circles back to the idea of these systems being adaptive. We want these systems to also think as any type of design goes forward, that we're promoting social equity and community and engaging important stakeholders in communities that have typically been underrepresented as we're designing these resilient strategies. And we want to make sure that anything that we're doing here is also accounting for basic human needs. So this depiction here comes from the World Health Organization for Climate Resilient Systems. And you can see on the left-hand side, the first determinant here of ultimate outcomes is the healthcare facility capacity level. So where are we at to begin with? And that pre-event capacity is also going to be impacted by any lead-in or chronic stressors to lead up to that shock to the system. The shock to the system and the damage done by that shock is going to depend upon three main components of risk. So first of all, the hazard. What is the type and magnitude of event? Maybe like how big and bad is the hurricane going to be? What's the exposure? So what elements of our systems exist in an area where those hazards are going to occur? Does that hospital sit on a floodplain? It's possible to be exposed, but not actually vulnerable. So maybe that hospital that's in a floodplain has sufficient means to modify that building structure, have backup power, and mitigate potential impacts or loss. So the third component here is the vulnerability of that system, or the propensity of the exposed elements, whether that's humans or physical infrastructure, to experience adverse effects when they're impacted by those hazards. So what's the building structure? Are there those backup generators? What does the transport system look like, etc.? In the recovery phase, depending on our capacity to recover, learn, and change, we may see a range of ultimate outcomes, and that can range from getting better to recovering to our previous state, being a little worse off, or a complete collapse. And in an ideal world, we see a performance drop, we learn from those mistakes, and we ultimately transform. The first step to building resilient systems is awareness and political and community engagement at both an individual and a systems level. So getting back to that resilient design principle of transcending scales. And from there, that needs to move into this cyclical process of intervention that's going to promote adaptive management, learning throughout the process, dynamic systems, and engaging all key stakeholders in kind of a multi-sectoral operative team that's going to lead this. So the last slide showing the World Health Organization wheel and process is going to look a lot similar to what we have in the US, specifically the CDC BRACE framework, which is obviously similar looking, systematically addressing and assessing risk, design and implementation of interventions, evaluation of the impacts, and continued adaptation as we're learning what works and as we're recognizing that this is all existing in a dynamic and changing situation. And so solutions that worked in the past might not be solutions that will work now or in the future. The Health and Human Services has also designated this climate resilience toolkit as a resource for health systems and has a similar stepwise process outlined, exploring hazards, looking at our vulnerabilities and risks, assessing outcomes, what are our priorities, planning, and then taking action. And again, in this continuous improvement and adaptation planning process. So these frameworks can help you be systematic as you go through these processes. There are lots of tools available with maps and charts and data to help you explore your risks. So this Environmental Public Health Data Explorer from the CDC allows you to narrow down on specific parameters that are of interest to you and to assess not only the hazards and the exposures, but the vulnerability of those who might be exposed. So you can look at different aspects like health insurance and access to care, age, presence of disability, whether or not people are living alone, etc. And so this map on the right here, you can use this query panel on the left to drill down to the data that you want to look at. And on the right-hand side here, we see this map that's an overlay of air quality due to wildfire smoke on top of a map showing the total population in each county. So you can see the number of people that might be exposed. But this could be further explored and drilled down to using different parameters so you could see how many people in that county have certain conditions or other vulnerabilities that might increase their risks of having adverse health outcomes. The CDC Vulnerability Index is another tool that you can think about using as you're assessing community vulnerability, health system vulnerability, and potential interventions that you can make in the adaptation process. So this Social Vulnerability Index, also reviewed elsewhere in this series, has 4 main themes and 15 indicators within those themes, looking at socioeconomic status, household composition, race, ethnicity, language, and housing and transportation, to kind of put into context these social and behavioral aspects as well as environmental and institutional context that's going to influence exposure pathways and determine health outcomes. And so addressing some of these different barriers can be part of an adaptation plan for a healthcare system. So the Health and Human Services Sustainable and Resilient Healthcare Facility Initiative has a toolkit with 5 elements to assess and plan. And these different elements come with checklists and tools to kind of start working through this process. The first element looks at climate risks and community vulnerabilities. The second looks at land use, building design, and regulatory frameworks that might affect the exposure to certain climate hazards. The third element is looking at infrastructure, protection, and resilience. Then we need to also look at that fourth element, essential and clinical care services and delivery planning. And finally, element 5 is environmental protection and strengthening of ecosystems. So getting back to thinking about sustainability as we also think about these adaptations to form a more resilient system. This here shows an example of a checklist. So this is element 1, looking at the climate risks and community vulnerabilities assessment. And you can see going down the list, does your healthcare facility receive notifications as an early warning for different hazards? And are you going to experience those hazards? So early warning is going to help you prepare. Do you or do you not get advance notice when these conditions are coming? And does that give you the capacity to prepare? So each one of these elements has similar checklists. This is obviously a much longer list and was cropped in this screenshot, but this is a worthwhile thing to check out, whether you're an administrator in a health system or even if you're just operating in a clinic or a pharmacy or something on a smaller scale. So planning for any of this and going through this toolkit should include a review of clinical care needs, personnel requirements, what sort of physical space and infrastructure is needed to maintain functioning of existing spaces in the event of a disaster or a stressor on the system, having available workarounds, and also thinking about surge capacity. So if we see an increase in demand for healthcare services, do we have the capacity to not only preserve our existing infrastructure, but also build up to meet that demand? And then also thinking about, finally, supply chain and resource availability. So what access are we going to have to essential medications, vaccines, medical equipment, and also just safe food, water, shelter, etc. And these steps here are going to help you review and then ultimately prepare a facility-specific and a system-wide vulnerability analysis that will then allow you to prioritize and plan. So when we're talking about supply chain issues, we're also not needing to only think about at a facility level or a health systems level, but this is really a global issue, as I outlined before in my previous presentation. So thinking about a pharmaceutical and medical supply chain, our finished products of generic drugs are 63% coming from foreign countries, and the active ingredients that supply those 88% overall. And so within this supply chain, not only is a lot of it coming from all over the world, but it's also this really complex global network for things are shipped from one place to another. There's no real transparency. There's no redundancy or adaptability of the system. It's really poorly regulated. We don't really know what's going on, and we don't enforce anything. And there aren't really financial incentives for having any redundancy in the system, for having surge manufacturing capacity or risk management. I've heard about maybe just-in-time supply chains, so we're just operating on razor-thin margins. And so if there's any stressor, this is going to result in chronic shortages and just kind of a complete inability to withstand acute stressors. So if you've worked in a pharmacy, in a hospital, you've maybe noticed, why is it that we're missing this essential drug, or there's a shortage and all of a sudden we're rationing these things? Even without climate stressors, sometimes we just have weird things that happen in our supply chain. And so as we think about increasing stressors from climate change, we're potentially going to see even more shortages in our systems. And if we go through and we evaluate that last slide and kind of compare it across with the resilient design principles that I highlighted earlier, we can see that we're really failing across the board and in almost every single way. And that, our systems aren't really adaptive, they're not transparent, they're certainly not simple. They're not sustainable, they're not using anything locally, and they're not really necessarily promoting good adaptability to anticipate interruptions and changing conditions. So, how do we fix this? This actually, even prior to COVID-19 and all of the discussion of supply chain during that whole process, there was an FDA review as a result of some of the hurricane impacts on our supply chain that did some evaluation of our systems. And so, evaluation and planning is really needed for both drugs and medical supplies at multiple levels: manufacturing, distribution, purchasing, and inventory management. And the FDA recommendations that came out of this report actually seem kind of laughably basic. So, first of all, they just recommend that we understand our supply chain. We really don't understand it right now at a systems level, so we can't really even develop any type of strategy to intervene. We also don't necessarily have good, accurate data that is going to allow us to improve risk management and improve the infrastructure in our supply chains. We don't have good information sharing, and as a result, we don't really have good coordination across systems. And so the third recommendation coming out of this report is just to promote some coordination, sharing of information. Also, just preparing at a system-wide level. So in something that's complex and there are a lot of moving pieces, adapting on one specific area is not necessarily going to be impactful on a broad scale. And a final recommendation that came out of this was just extending expiration dates on drugs to prevent drug waste. And if we think about this and we better understand our supply chains and we make these adaptations, this can be a step to improve both sustainability and resilience within our supply chain. So if we understand where things are coming from, then we can also take steps to improve the emissions that are generated from it. Maybe we can cut out inefficiencies. If we extend expiration dates, we're not making unnecessary medications and using those resources that are going to further impact our environmental footprint. So all of these things are really essential for multiple reasons. And as somebody kind of across the potential supply chain sphere of influence, yes, you might not be a manufacturer or a distributor, but you might be somebody involved in purchasing decisions or in inventory management. And you might be able to ultimately influence those purchasing decisions in the supply chain and opt for purchasers that potentially have more sustainable practices and have a more transparent supply chain. You can put pressure on them from below to potentially adopt some of these measures, because this is now and will be in the future a significant issue for our ability to provide healthcare. Another more specific area that I wanted to highlight in this presentation, particularly because it's a hot topic right now due to the COVID-19 pandemic, but also just because it's going to be another really important and maybe somewhat neglected area, is our climate smart changes to vaccine and drug development. So thinking about the lessons learned from the COVID-19 pandemic and realizing what sort of stressors might be at play as we see changing patterns of infectious disease, increased risks of pandemic. We're going to need to be much more proactive in our development of novel drugs and vaccines, and know that that scale, that time scale that is required to develop these interventions and distribute them is a long time frame potentially, and we don't necessarily have at baseline good production capacity and distribution systems. If we get back to the idea of resilient design principles, we don't have any redundancy and durability in our systems. We need to change our incentives. So when we think about push incentives and pull incentives, those push incentives are going to be things like funding basic science, working on regulatory review so that we have the ability to fast track certain things, developing clinical trial infrastructure, potentially so we can conduct these clinical trials on a large scale basis. All of these conversations are happening right now at a much higher level due to COVID-19. We also probably need pull incentives. So this is the other option, is to ensure profitable markets for vaccine manufacturers, thinking about advanced purchase agreements. So if people are going to work on development of a vaccine, we should potentially give them some sort of guarantee that there will be purchase on the other end, so that financial risk that they're taking or the investment that they're taking will ultimately pay off in the end. The other thing that we really, really need to consider in all of this is climate justice, health justice, and social justice are all wrapped up in this, and they need to be central in our discussion of patents, pricing, and distribution of vaccines and drugs now and in the future. So how are we going to look at who owns a drug or a patent, who gets priority, how is that affecting our global distribution? So who gets vaccines, when do they get them, and how do we ensure that we improve our coordination of these efforts across the board? We need to embrace the fact that we're a global community. We're hopefully learning that lesson through COVID-19 and coordinate at a global level. Something that's always kind of shocking to me is thinking about the funding of the World Health Organization, which was funded at a budget of $4.4 billion in the 2018 to 2019 fiscal year. This is compared to $1.2 trillion in funding for the U.S. Health and Human Services, with additional billions in discretionary funds granted to them. So when we think of $4.4 billion, that might sound like a large number initially, but when we compare it to the budget of other organizations that serve potentially a much smaller population, this is something that we could potentially do to help improve overall resilient care and think about our overall capacity to provide vaccines and drugs as we have these increasing challenges from infectious disease. So you might be asking yourself, are we actually prepared? Have we gone through this process? And this map here shows a grading system looking at preparedness grades across the United States for various states. And if you look at Montana, we actually unfortunately earned a D grade in this report. And what this means is that we really haven't invested or taken the time or developed a comprehensive plan for climate change preparedness. And this includes public health strategies, health systems interventions, those sorts of things. So while we might not have the same risks of sea level rise, hurricane, etc., that other states are dealing with, we also have not yet really invested the time and energy needed to come up with a good adaptation plan for our state. And this can be really important when you think about this from your individual actions, but also on an advocacy level when you're thinking about what sort of large-scale policy changes need to be made to address climate change. The other important thing that I just wanted to highlight here is that these resilient and sustainable systems are going to take everybody. So if you look at the wheel on the left, the building blocks of these systems, everybody is going to need to be engaged. Everybody from the workforce, the leadership, as we're looking at, other people involved in health information systems, finance, technology, developing these new things, service delivery. These are all going to be key players as we're building this climate resilience. And so ultimately making sure that we as individuals are not working in silos, but we're reaching out across the various stakeholders in our systems and working together to collaborate and come up with these solutions. And I'll talk about this in a later section. We talk about interprofessional solutions to build resilience in our systems. Finally, this slide here just has some additional recommended resources. So as you're thinking about this in your facility, or you just want to learn more about these processes, you can look at these international, national, and local resources, including, I did want to call attention to CSKT and Blackfeet Adaptation Plan and some really nice work that has gone on there to look at adaptation strategies. These resources here you might think are, potentially above the level that you're operating on. But these frameworks, as I mentioned before, will work on a small scale too. The process remains the same. So just thinking this through, looking at vulnerabilities, learning more about what you can do is all going to be an important step in health systems adaptation.